Hi, my name is Melanie and I am your IVF nurse. Today we're going to talk about progesterone. So what I've got here are some samples, and the most commonly used progesterone is these suppositories here. So when you look at them, each of them are perforated and they can come in packages of 18 or 14. These are available at Pace Pharmacy as well as some other compounding pharmacies, but I do know with Pace Pharmacy they also actually supply an applicator with each packet that they will distribute to you or dispense to you. With the progesterone suppositories, they are perforated so that you don't have to carry a whole pack with you. You can carry them singly or individually. They are a waxy compound, so what you'll need to do is keep them cool, so especially in the heat they will melt, which will compromise the progesterone in them, but they just peel open like this, and then what you're going to do is just take it out, and they are a waxy compound, so they will melt if you hold them too long in your hand. As I mentioned, Pace Pharmacy does have an applicator that they provide, so what you would do is take your applicator, put the suppository, pull the handle back, put the suppository in, and then insert into the vagina to what feels comfortable to you. Now, some compounding pharmacies do not provide an applicator. This is why I prefer Pace Pharmacy, because they will provide an applicator. It's a little bit neater, I find. This here, if you're not using an applicator, you would just take it and insert it. If this was your vagina, inserting it as far up as you can, and then it just sits there. Some clinics will recommend that you rest for 5 to 10 minutes afterwards, just so that it can dissolve. It will give you a waxy, oily vaginal discharge, so you will need to wear a thin pad or a panty liner. So that is the progesterone suppositories, and these can come in 100 milligrams, 200 milligrams, whatever your doctor specifies. Once again, Pace Pharmacy, they are a compounding pharmacy, and they can make them as per the doctor's prescription. Now, the other form of progesterone that you can use is called endometrin, and it comes in a box of 21. They look like this, or they come individually wrapped. This is a product of Ferring. And what happens is that you would just peel out one, and it is a vaginal tablet, and each one is 100 milligrams. It's an effervescent tablet. You also get applicators with your endometrin tablets. So what you would do is open up your applicator, and it would just pull back the handle, insert that like that, and then pushing it up into the vagina, and then you would push the top or the bottom of the applicator, the plunger, to have the tablet release into the vagina. So if this was your vagina going in, and then you're pushing in that plunger part and then removing the applicator so that the tablet sits in the vagina. Okay, so that is endometrin. Now, the other form of progesterone is called Crinone. This is a product of EMD Serono, and with the Crinone product, it is a vaginal gel. And when you open up the package, it comes in a box of 18. When you open up the package, each one is individually wrapped. Now, when you look at the Crinone, it's already in its applicator. The gel is in this part, in this kind of boxy looking part. That's where the gel is. So what you need to do is flick it down like this so that the gel comes down to this end here. So you're flicking it, and then you're just going to twist this cap off, and it puts an opening just there at the tip of the applicator, and then going into the vagina. So when this is your vagina going into what feels comfortable to you, and then you're actually squeezing this bulb at the end, and the progesterone is coming out. Once you've squeezed as much as you can, you're going to pull this out, and the gel adheres inside, attaches to the wall of the vagina. So the gel itself looks like this, not too great. One of the complaints of this is that some people will complain that they will have vaginal casting, where the gel accumulates, or it gets kind of hard, accumulates in the vagina, and then it kind of comes out in little chunks, or you'll have to manually go in and remove the dry gel up. Now, with the progesterone suppositories, as noted before, because it is a waxy, oily compound, you will have a waxy, oily discharge, so you will need to wear a thin pad or a panty liner with this. The last form of progesterone that I'm going to talk about today is progesterone in oil. This is an intramuscular injection, and when you're getting it from your clinic, you will have a 3 cc syringe that comes with a 22 gauge needle on it and an 18 gauge needle to remove the oil. So what you're going to do is open your needle up from the packaging. The 22 gauge needle, you're going to just unscrew it so that it comes off. You're going to open up the 18 gauge needle, and this is going to screw on. You're going to remove that. It is a large needle. It's 1.5 inches long. You can get these to be 1 inch long, but it is an 18 gauge needle, and it's used only to withdraw the progesterone in oil out of the vial. Pace Pharmacy compounds this as well, and you can get it in various forms or oil bases. So sesame seed oil, cottonseed oil, castor, and then one of the newer forms is an ethyl oleate base, which tend to be really good in terms of reduced allergic reactions, reduced lumps, because those are all common side effects with the progesterone in sesame oil, castor, or cottonseed oil. When you're doing this, this will have a seal on it. You're going to peel the seal, clean it with an alcohol swab, take your needle with the syringe, and you're going to go in through the rubber stopper. You need to turn it upside down. So you're going to withdraw 1 cc or whatever your prescribed dose is. So the 1 cc right there, you're going to take that off. This, you're just going to put it back. You're going to unscrew this big needle because you don't want to inject with this needle. So you take the cap and you're just going to carefully recap the needle and unscrew. What you're going to do next is take your 22 gauge needle and you're going to screw that on. Usually what I recommend is that you screw it on until you hear that kind of squeaky noise to know it's on securely. Take off the large cap. It is an intramuscular injection, so it is 1.5 inches long. You want to remove any air bubbles, so I always pull back a little bit, give it a few flicks, get those air bubbles up, and then just gently push up to remove any air from there, and then you're going to do this intramuscular injection. Okay, now this also, as I mentioned, is available at Pace Pharmacy, and it's available in 3 forms of an oil base, so cottonseed, castor, as well as sesame seed, and then it's also available in ethyl oleate base, which I find is new, up and coming, and very, very good. A lot of patients love it if they're having to do progesterone injections. If you would like further information on Pace Pharmacy, their website is www.pacepharmacy.com. Their phone number, 416-515-7223. My name is Melanie, and you can reach me at yourivfnurse@gmail.com. And please feel free to check out my website, www.yourivfnurse.com. Thanks for watching.